name is Chris Campbell. I'm a practicing CPA, and I work with small businesses and individuals to help them pay the least amount of taxes possible while keeping them out of jail. So this talk was going to be more about wealth preservation, not necessarily taxes per se. And I wanted to reiterate this. I actually saw this was shared to me on social media a little while ago, and it is about Eldercare. I had spent a good amount of time in the Eldercare space. The franchise that I owned and operated was in the Eldercare space, so I'm pretty knowledgeable about the industry. And this was shared to me on social media, and it was something that just rang true, so I figured I'd just reiterate it. So if you're in a situation where you're taking care of elderly parents, or even if you're in a situation where you want to set yourself up where you need to be taken care of as you get older, this was in regards to nursing homes and home care. So there's a big misunderstanding that if you wind up going to a nursing home, that's covered by regular medical insurance or Medicare, which is the insurance the government provides once you hit 65, 66, I believe. And what most folks think, that covers your stay in a nursing home. And that could be farthest from the truth. And anyone, if you've had experience in dealing with nursing homes, you'll know that it can be quite an expensive deal. When I was in the eldercare business, I was looking at nursing homes for some clients, and they ran in the range of about $400 a day. This was right before the pandemic, so probably a bit more now. You're probably thinking somewhere in the range of about $500 a day to be in a nursing home. And understand that this is not covered by regular health insurance. And I recall just having to talk to a number of different families and clients as they wanted to pursue options for their loved ones that they couldn't stay home. They either had to get home care post at home, but if you couldn't stay at home, you had to go to a nursing facility, nursing home. And there's no coverage for that through regular insurance. So your traditional medical insurance doesn't cover it, nor does Medicaid cover it. So you're on the hook for actually paying this thing out of pocket. And like I said, at roughly $500 a day, that can quickly drain a nest egg that you might have saved up for retirement. So there are a few things that you can do to avoid this and or not pay for this out of pocket. A couple options you can do, but the problem that a lot of people run into with this is that you have to plan for this well in advance, and a lot of folks don't do that, and by the time they figure they need it, it's too late to really execute these options. So this is something that you really need to start planning for when you're in good health, because I can't tell you how many times that I've seen families have to deplete their savings or their nest eggs thinking that, okay, this is going to be my retirement, I'm going to enjoy it, or even if it's something where the plan was to pass down wealth to other generations or children, and it gets all sopped up in taking care of that member in their ending days. But yeah, there are a couple of things you can do to avoid being in that situation. But again, you have to plan for this years in advance. Once you need it, it's too late to start planning about it when you need it. A couple things you can do here. So the first thing is long-term care insurance. There are insurance policies out there that do cover this stuff, and it's called long-term care insurance. And what people tend to get conflated is medical insurance and long-term care insurance. They are two completely different things. Completely different. Staying in a nursing home is not considered medical care. So you have to look into long-term care insurance policies. Now, you want to look into that early. The earlier you do it, the better it will be, because just like with a life insurance policy, with long-term care insurance policies, the older you are, the more expensive that it is when you start. So it is one of those things where you want to lock it in when you're relatively early, when you're relatively young, and pay into it as you go. I would say a good age to start looking at it. Earlier the better. It becomes much more expensive to do once you start getting into your 50s and 60s, because obviously you're closer to the time that you would need it. So when you get the long-term care insurance policies, it covers this stuff. If you need to go into a nursing home, if you need home care, it'll cover that. And the longer that you pay into it, the more the benefit that you'll get, because the benefits, the way that it works is most policies nowadays, they'll give you a certain amount of dollars per day to cover such expenses. And then even with that, there might be a cap. So for example, you can get a policy that it's $300,000 in total that they'll pay out, and they'll break that down over, let's say, a 3-year period. So they'll take the 3 years, divide 300,000 by the 3 years, however many days it's in the 3 years, the 1,200 days or whatever have you, and that's how much they'll allocate per day to put towards your care. In some instances, it covers the full nut, which is great. In some instances, it doesn't, in which case you'd have to cover the difference. So let's say that you have a policy and they'll pay you out $300 a day. But going back to my example, the nursing home may cost $500 a day. So then you'd be on the hook for the remaining $200 a day. But again, the earlier you get to the policy, the more coverage you would have in the long term. The other thing is hopping on Medicaid. So this can be a least expensive option, but the idea is qualifying for Medicaid. If you're not familiar with the difference, there's two sorts of insurances that the government is: Medicare and there's Medicaid. Medicare is the insurance that everyone gets once they turn 65. Everyone gets that, regardless of your income level, whatever you have going on, that's available to you. Medicaid is the insurance for folks who don't have assets or those that are a lower income. There's an income requirement to cover Medicaid. Now, Medicaid actually does cover nursing home care. Medicare does not, but Medicaid does. Now, you may not have your choice of where you want to go, but nonetheless, nursing homes do have an allotment for Medicaid patients. Most of your better nursing homes just have a small allotment because of what Medicaid pays out. It's a lower payout than what that nursing home could get on the open market. Now, you do have some nursing homes that are 100% Medicaid, but you know, you're going to get what you pay for. The quality is not going to be as good, but nonetheless, it's something that you wouldn't have to pay for. To qualify for Medicaid, you have to have no assets. I mean, you can't have any assets at all. Or you can, but it's very small. Your retirement has to be drained out. You can't own any property. You probably can't keep more than a couple $1,000s in a bank account. So you really have to have nothing to qualify for this. And there's a 5-year look-back period to qualify for it. Let's say you have all this money and you want to qualify for Medicaid. You can't just give away or transfer your assets and then shortly after go and then try to get on Medicaid, because you won't qualify. So there's a 5-year look-back period. So you really have to have no assets for the 5 years leading up to the time that you need it. Now, this can be a strategy that you use, but again, there has to be some planning involved with this, because if your plan is to qualify for Medicaid, you need to start transferring these assets out at least 5 years prior to you actually needing to be on Medicaid. Most folks, when you figure out that you need it and they put you onto the game, it's too late. So if you're doing some family planning, you need to start doing those transfers of assets. Now, one tool that you can use to do that is trust. Trust is a good way to do that, where you can transfer your assets, and it has to be an irrevocable trust. And that way you can transfer those assets into this trust, and it would be deemed as you not having those assets. You transfer it to an irrevocable trust. The assets are still there, but the key is the trustee. With the trustee, you have to make sure that it's someone that you trust and is not going to squander your assets, because once it goes into the trust, you technically don't have control of those assets anymore. The trustee does. What most folks do is you put it into the hands of a trusted child, not one who's going to go and blow all your money. You make them the trustee of the trust, and they essentially just keep it for you. And then that way, when the time comes, and when they do the look back for the Medicaid, those assets wouldn't count because you technically have no control over them. So that is a strategic way that a lot of folks do, is to transfer their assets down to loved ones, and then can still qualify for the Medicaid and not have to drain their assets on nursing homes, home care, and some end-of-life issues. So that's all for now. So if you have any questions about this, any other tax or accounting questions, feel free to reach out. Happy to help. Until then, see you on the next one.